Now that the major organs have been removed from the body cavity, only a few things remain to be examined within the carcass. These include the joints, bones, bone marrow, infraorbital sinuses, brain, and eyes. Opening a few joints should be a standard part of any necropsy exam, even if there is no obvious external swelling. If sterile samples are indicated, sterile instruments and aseptic technique should be used to open the joint. To begin, place a finger over the joint while you flex and extend it. As you do this, you should be able to feel the joint cavity move beneath your finger. Take a blade and make a cut over the joint to expose the underlying fascia. Locate the smooth, white joint capsule and use your blade to incise the capsule and expose the joint. A small amount of joint fluid may be observed in the synovial space. The fluid should be viscous and clear or slightly yellow in color. Inflammation within the synovial space can result in fluid that is opaque, discolored, or has an abnormal viscosity. Fluid can be swabbed and submitted for bacterial culture. Examine the synovial membrane. The membrane should be thin and free of any lesions. If any abnormalities are observed, remove a small piece of tissue and place it in a cassette for histopathological evaluation. Once the joint has been opened, evaluate the articular cartilages of the bones. In order to fully visualize the articular surfaces, you may have to disarticulate the joint with a blade. The cartilages should be smooth, shiny, and white with a slightly blue tinge. Degenerative changes, as seen on this femur with femoral head necrosis, may produce roughened areas, erosions, and have a dull, discolored surface. To assess the thickness of the cartilage, tap on it with a metal instrument. Normal cartilage should have a dull resonance. Thin cartilage will produce a sharper sound because the instrument will be striking closer to the underlying bone. Assess the quality of the bones. To begin, deflesh the tibiotarsus or metatarsus as much as possible. Next, assess the degree of bone mineralization by bending the bone. A healthy bone will snap when bent. An osteopenic bone will bend without breaking. In a young bird, you can cut the long bones longitudinally to examine the epiphysis. Nutrient and mineral deficiencies can lead to poor mineralization of the bone. Look for widening of the epiphyseal plate or generalized hypoplasia of the bone. Bone marrow can be collected from long bones in the leg or from the ribs. Take a pair of rongeurs, or if the bone is small, use poultry shears, and create an oblique fracture in the bone. This will expose the marrow cavity for inspection. In young birds, the bone marrow should be red due to hematopoiesis. With age, the bone marrow fills with yellow adipose tissue. Red marrow in a mature bird may be a sign of increased hematopoiesis. Regardless of age, bone marrow should have a gelatinous consistency. A more solid consistency may indicate infiltration by neoplastic cells. Following the visual inspection, the bone marrow sample is collected for histopathology. Leave the marrow in the bone and place the entire sample in formalin. Finally, evaluate the costochondral and vertebral junctions of the ribs. Some nutritional problems can produce nodular proliferations or a generalized collapse of the rib cage. The contour of the ventral vertebral column should also be assessed for deviations, swellings, or fractures. Examine the interior of the infraorbital sinuses. Open each sinus by inserting a pair of sharp scissors into the medial canthus of the eye and cutting rostrally toward the nares. Use sterile instruments for this procedure if you intend to collect samples for testing. Because the sinuses drain slowly, they are a good place for exudate to accumulate. The normal sinus should be free of fluid or other material. Caseous or purulent exudate is evidence of upper respiratory infection, and samples can be collected for culture. Tissue samples of the sinus membranes can also be taken for histopathology. Next, the brain will be removed and examined. Though time-consuming, a thorough necropsy should include examination of the brain. This is particularly important if nervous signs are observed clinically. There are a number of methods that can be used to remove the brain. The technique demonstrated here is preferred by many pathologists as it provides good exposure and minimizes accidental tissue damage. Generally, it's easier to manipulate the skull if the head is kept attached to the body. If desired, the head can be removed by disarticulating the skull at the level of the foramen magnum. To expose the skull, make an incision in the skin, caudal to the comb. Peel the skin laterally to expose the bone, and remove the comb. The skull should be smooth and glistening. Postmortem congestion and hematopoiesis can produce a reddish color to the skull. This should not be confused with head trauma. To remove the calvarium, take a pair of rongeurs or scissors and make a small cut through the skull. Carefully insert forceps into the edge of the hole and gently twist up and out to peel away a small piece of bone. Expand the hole with the rongeurs, exposing the cerebrum and cerebellum. The skull is very thin, so work carefully to avoid penetrating the brain. Once the entire surface of the brain is exposed, you will remove it from the skull. Sever the brain stem and tip the brain forward. Grasp the periosteum with forceps to create tension and peel the underlying meninges away. Once the optic nerves are exposed, sever them with a blade. Gently lift and remove the brain. Make a surface inspection, assessing its symmetry and looking for lesions on both its dorsal and ventral surfaces. The avian brain does not have gyri and sulci, so its cortex should appear smooth and glistening. The brain should be placed in formalin and should not be sectioned until it is fully fixed. If the pituitary gland did not come out with the brain, it should be dissected out of the sella turcica and placed in a cassette for later identification by the pathologist. Once the brain has been removed, the eyes are more fully exposed, making them easier to remove and examine. The eyes in birds are quite large and extend inside the bony orbit. Use forceps to grasp the skin and dissect around the eyeball. If necessary, cut through the bony orbit to completely free up the eye. Remove the eye and examine its posterior aspect for Harderian gland enlargement. Fix the entire eye in formalin. At this point, all the tissues have been removed. Take one last look at the carcass to ensure that you have not missed anything. Once you are certain that you're finished with the body, discard it and concentrate on individual organ dissections.